everyone. Welcome to Move Well, Live Well. We get a number of people that come in here with issues regarding their hip, and in particular the front of the hip. And it's basically hip pain in the front of the hip that won't go away. They've seen the chiro, they've seen the physio, they've seen their orthopedist, and they've been diagnosed with tight hip flexors. And they're getting cortisone injections in there, they're taking ibuprofen, all this stuff, and they've been prescribed stretches for the hip flexors. So stretches to stretch the hip flexors and all this stuff, right? You see that? Stretches for the hip flexors, doing this, and it's pain that won't go away. They're getting pinching, grabbing, sometimes groin pain, and when they do squats, they get a pinch, and when they're lifting their thigh up like this in hip flexion, it feels kind of weak. So what's going on here? Why is this hip pain not going away? Well, it's a condition known as Anterior Femoral Glide Syndrome. And what's happened here, I brought out Netter, but I also brought out this. This is a great picture here. This is from Mana Performance Therapy in New York. He's a doctor, they're doctors of physical therapy there. I don't know if you can see this, but this is a side view of your pelvis. And then the ball and socket here, well, let's go down here. This is better. So this is a side view of your pelvis, and you see this circle right here. That's where the head of the femur should sit. And it sits in the center, right there in the center of the acetabulum. See that? Now what happens with anterior glide syndrome is that it has moved slightly forward. You can kind of see that? It's the head of the femur here has moved slightly forward. It's no longer sitting in the center of the acetabulum. So they're experiencing that pain and discomfort. And when this is Netter, these are the structures in the front. This is the front of the pelvis here. This is your psoas. This is the iliacus right here. Together they make the iliopsoas. And then you can kind of see if it's been cut. You can see the iliopectineal bursa, and then the capsule, the joint capsule of the hip itself. And you can kind of see if this sucker's moved forward towards the camera, these structures get kind of pinched in a way. In a way they get pinched, and that's the discomfort that they feel. And they've been diagnosed with hip flexor tightness. They're doing the stretches, not working. Well, how do you fix that? How do you fix this hip? How do you fix this forward movement of this hip here? So here's this is where it should sit. It should sit in the center, and now it's moved forward. How do you fix that? Well, I got a good old power rack here, and I've set up the band. Start out at the bottom here, and just like this. And then what you're going to do is you're going to put your leg in here. So let's say I have problems with my right hip, just right here. So you're going to go right here. You're going to put it right here in this crease. Make sure you be careful with your privates. And you don't pinch those off, because that's bad. You don't want to do that. And you're going to put a little bit of tension right here. You see this? It's a little bit of tension is pulling backwards. And now you can kind of see this tension is pushing my femur back. And that's what we want, because remember the femoral heads kind of move forward. We want it to be pushed back. And so we're going to start here like this, and we're just going to kind of oscillate back and forth for half a minute to a minute. You see that? Half a minute to a minute, just like in here. And then we're going to bring the knee forward. Again, half a minute to a minute in here. Eventually you get to a point where you're all the way into full hip flexion. Your torso now is sitting on, see that? Is sitting on your thigh. And you're just going to oscillate back and forth in through here. Just like this, 30 seconds to a minute in those positions, okay? When you're done with that, now that you've kind of pushed the head of the femur back in the socket a little bit, you want to contract the glutes. The glutes are a powerful muscle, and let's face it, we sit way too much. And weakness in the glutes is going to make that head of the femur keep slipping forward. So it's not going to fix the problem just by doing this all the time. So you want to strengthen the glutes a little bit. So what I usually tell our patients to do is you're in here, you're going to create tension, and I like to tell folks to put their finger on their butt right here, and you're going to move this forward. See that? Just like that. You're going to bend at the waist, hip hinge. This is hip hinge, and you're going to squeeze. You can feel I can feel my butt muscle squeeze like that. 1 set of 15 to start. And you can kind of be really deliberate about it. Really feel that squeeze. So here you are. Squeeze that butt. 1 set of 15. And sometimes 1 set of 15 is enough. Work up to 3 sets of 15 as you do this. And again, it's not a full range. We're not going all the way. If you want, we're not going all the way down and all the way up. We're just kind of trying to get that glute to activate a little bit. See that? Boom. So it's a partial range of motion in there. Just to get that glute to activate, because that glute has been deactivated from we sit way too much. Now, the next position is you want to bring this up to hip height now. So here we are. I'm going to bring this up to hip height, just like this. I'm going to do in here. Again, watch your privates. You're going to be in that hip crease right there. And we're going to move forward like this. And now you can kind of see, again, this band is pushing my my thigh, my femoral head that way, posterior. So again, you're in here, and again, you're going to bend just a little bit right here. I'm just going to oscillate. Just like that. 30 seconds to a minute in here. See that? 30 seconds to a minute right in here. You can even get more of a bend. 30 seconds to a minute in here. You can use your other thigh for support if you'd like. 30 seconds to a minute in here. And then you can also get in here like this. See, 30 seconds to a minute right in here. Yeah. So do those. 30 seconds to a minute. And then now, we're going to keep this tension, and I'm going to keep my knee straight, and I'm going to bend at the waist like this, hip hinge. I'm going to hip hinge, and I'm going to put my finger on my butt. We're going to get some of these glutes to activate. Boom, like that. Woo. Boom, keeping the knee straight. Boom. Boom, nice and deliberate. See that? Boom. So, 1 set of 15 to start, work up to 3 sets of 15 to activate the glute. It's not a full range, it's just a partial range, but the idea is to just get that glute to fire so that way it sits in the socket better. Because what happens, again, right here, that head of the femur has moved forward in the acetabulum, and that glute, by firing that glute, it's going to help sit it backwards. Because yes, you could do that distraction. You can do that distraction all you want, and it'll help, but it won't fix the problem. But that glute, to get that glute to fire on a regular basis, that's what's going to keep that head of the femur in the socket. Anyway, if you have any questions with this video, drop it off in the comment section below. We thank you for watching. We appreciate it. If you're new here, hit subscribe. And when you hit subscribe, make sure you hit that bell notification button, because that'll keep you in the loop with subsequent videos coming here in the near future. That way you can continue to move well and live well. Also, I know you know folks who are battling hip pain in the front of the thigh here. That's not going away, and they've seen all these people, and they've been prescribed stretches, and it's not getting better. Because those stretches, check it out, if you do this, it just pushes the head of the femur further and further forward. You see that? So here I am, I'm doing these stretches and doing this, stretching the hip flexors, and it just keeps pushing the head of the femur forward, more and more forward. Problem's not going away. Stop stretching the hip flexors for this particular condition. Don't do it. So share this with them. Sharing is caring. They may have Anterior Femoral Glide Syndrome. Also, give us a thumbs up, give us a like. It lets us know you care. Anyway, we thank you for watching. We appreciate it. We'll see you next time. Take care. Bye-bye.